All right. Hello, everyone. I am the Graduate Student Association's Vice President, Lexi Hoopman. Welcome and thank you all for attending GSA's COVID Response Q&A. I want to say a special thanks to the amount of your day to address graduate student concerns. That means a lot to us. And graduate students, I want you to know that we have heard your concerns. We've developed this Q&A webinar to convey accurate information about UNCG's COVID-19 safety coordination for this spring semester, as well as to address questions and concerns around these safety regulations. Last week, a survey was sent out to graduate students to collect topics that we will be addressing today. Thank you to all of those students that participated in that survey. We will start with those questions first. And once we start, if you haven't already submitted your question or it hasn't been answered yet, please use the Q&A function to submit it to the panelists and they will be able to respond. Now it is my pleasure to introduce our panelists. So we have Dr. Franklin Gilliam, Jr., our Chancellor, Dr. Debbie Storrs, Provost and Executive Vice Chancellor, Dr. Kathy Akins, Vice Chancellor for Student Affairs, Dr. Greg Bell is the Interim Dean of the Graduate School, Dr. Andrew Hamilton, the Associate Provost for Student Success and Dean of Undergraduate Studies, Dr. Brett Carter, who's the Associate Vice Chancellor for Student Affairs and Dean of Students, Zach Smith is the Assistant Vice Chancellor for Emergency and Risk Management, and Dr. Tracy McMillan, who's the student analysts are making up the COVID-19 planning team. We do have two other administrators in attendance today that may pop into the panel if needed, and that is Dr. Adrienne Craig. She is the Associate Vice Chancellor for Student Affairs and also our GSA advisor. And we have Dr. Paul Steinley, who is the Graduate Council Chair. And with that, now I will turn it over to Chancellor Gilliam for a welcome, and then we will start with questions.
Thank you, Lexi, and thanks to GSA for organizing this event. Obviously, it's been a very long and challenging couple of years plus, and I know for the graduate students who are on in the audience today, you faced a lot of personal challenges, and trying to get a graduate degree in the face of a pandemic is a very difficult task. So we understand that. I am, though, proud of what we've been able to do over these last couple of years, particularly the campus response, which has really been strong. We've adapted, we've learned, and we haven't always been perfect, but I think we have put as paramount the safety of our students, our faculty, and our staff. And so we're trying to make the best decisions in the interest of the campus community. Now, one of the things that we've learned is that students do better when they have face-to-face classes and face-to-face services, and they perform better academically. However, you have to balance this against safety. And so this has been really utmost in our minds. Much of our success and by the way, we had the last year really, the lowest per capita positivity rate in the UNC system. And much of that success has been obviously due to what folks on the campus have done, but also a strong collaboration with partners such as North Carolina Department of Health and Human Services, Guilford County Public Health, and the system office here in UNC. We've also followed, and you'll hear from some of our experts here, guidelines issued by the CDC, and sometimes it required us to pivot quickly, but we did. So we're just to sort of make a comparative point, we've almost, for the most part, our response has been similar to other schools across the campus. We're not outliers in our practices. Everybody now, for example, in the system is back in person. I think only one or two schools delayed by a bit. I'm just on a call, all the chancellors are on a call this morning, and we require many of the same protocols, masking, we have a variety of testing options, limiting large gatherings, limiting events, limiting events, limiting the ability to have food and alcohol on campus. But of course, it doesn't mean we have zero transmission. We see that there's spread among the campus, and Zach can give you some more data. But I think that we're hovering around 10% right now, which is pretty significant given that it spiked a couple of weeks ago. They'll give you some more data on this. But we try to be responsive and try to be flexible. We've used Higher Education Emergency Relief Fund data to assist students in a variety of ways to support your safety and your continued enrollment. We've encouraged the faculty, and Provost Storrs will talk about this, to be flexible with classes when people are sick or exposed. And they've shifted in many cases to short-term remote delivery when it's been necessary. But 76% of our classes now are either in person or hybrid, and about a quarter are online. So we've been trying to be flexible, but we are trying to ensure that we have very positive learning outcomes. And we know that having face-to-face instruction is the way to do it. But we also understand that we have to think about the campus safety as well. Let me just end by saying that this is a far cry from what any of us envisioned over these last couple of years. Nobody predicted this, nobody encouraged this, nobody wanted it. And I like to say tongue in cheek, they don't teach you how to be chancellor they don't teach you how to deal with the pandemic at chancellor school. There is no chancellor school. Point is that we've had to build the airplane as we're flying it. I think we have an extremely strong team, and they too have put your safety and your academic success as paramount, and will continue to do so. So Lexi, I think I've you never give an old professor the mic. I could continue to go on. I got about another 70 minutes before I really have to look at my notes. I'm happy to do it. What do you want to talk about? Art, architecture, music.
Thank you so much, Chancellor Gilliam. We really appreciate that welcome. With that, I'm going to start with the questions. And like I said earlier, if your question hasn't been answered, please utilize the Q&A function below. The first question is a very popular one that we got in our survey. It's about virtual versus on campus. We know that some universities have chosen to start the semester with remote instruction only. Why has UNCG not moved all academic classes to the virtual platform this semester?
Hi, Lexi. I will take that question. Provost Debbie Storrs, honored to serve here at UNCG, survived my first fall semester, and honored and humbled. And I'm really excited to meet with graduate students. You play such an important role on this campus, both in terms of your pursuit of your graduate degrees, but many of you are also teaching. And so you're part of that instructional staff as well. And we talked about this as a leadership team and in the COVID safety strategy team as well. And I want to reiterate a couple of points that our chancellor noted in his welcome remarks. We decided to start our spring semester in person because of the kind of institution we are. The students we serve were predominantly an on-campus, in-person program campus. We have some really vibrant online programs. And we also know a lot of information from previous semesters in terms of what were the learning outcomes when we had to move hybrid. And we also have other layers of safety that we didn't have in previous semesters or years, certainly. And so there's layers of safety. In particular, I was really pleased of our vaccination rates and our vaccination and testing practices and policy. And I want to thank the graduate students and our faculty and staff and our undergraduate students for embracing the vaccination, because that's the key way that you're going to make yourself safer. And so I appreciate you doing that. So in addition to that, we've also offered and required masking in the classroom. Instructors who are teaching face-to-face, including our graduate student instructors, have N95s available if you choose to use them. And then we've encouraged students, our undergraduate students, to use the surgical style 3-ply face coverings, and we make those available because it provides another layer of safety beyond the cloth mask. So that's why we chose to go in person. Now, as the chancellor mentioned, I've also empowered our instructional staff to make decisions on a short-term basis. If you have a number of your students who need to isolate, that a certain percentage of your class are isolating, and it makes more sense for you temporarily to go online, I've empowered our instructors to do that. And so we think this is a way to manage as we go through this peak and this surge. And I'll let Zach speak to that in a moment, but we're hopeful that we're going to see a decline and that we're going to be more comfortable getting back to the classrooms because we'll have fewer students isolating. The number of students who've had to isolate is lower than we anticipated, which is good news. And again, I think it's a function of the safety measures that students are taking and the face coverings. But those are the reasons really why we started the semester in a face-to-face format.
Thank you, Provost Storrs. Zach, did you have anything you wanted to add to that?
Certainly, just to speak what the provost was saying about the peak of the pandemic, or at least the Omicron variant. And this is a little bit of conversation in the scientific and medical community right now, but there's good data that supports that we have reached the peak of the Omicron variant. If not, we are very close to it. But we have started to see some of the numbers and case counts go down here on campus, locally in our community. Our hospital figures are going down as well. So while it's been a very rough road, very happy to see that we're starting to start that decline.
Thank you. And Provost Storrs, you touched on this a little bit, but to ask just to make sure we're all on the same page. For PPE, we've received many questions about PPE supplies. So what does the university currently make available to students, faculty, and staff? And will the university be providing students and non-teaching faculty N95 or KN95 masks? And are departments able to do this for their students continue to supply these?
Thanks, Lexi. I'm going to turn this question over to Zach, but I will say that when his team was able to secure the N95s, we have a limited supply, and so we prioritize instructional staff, and our staff were front-facing in terms of student-facing. And that's because they tend to be older, number one, and they also tend to be talking more in the classroom. And so we think the N95s needed to be prioritized for our instructional staff, including our GTAs who are instructing. Zach, I'll turn it over to you.
Yeah, thanks, Provost Storrs. So that's exactly right. So early in the semester, we communicated out the importance of wearing an appropriate face covering, one that secures to your face. And that's really still the main takeaway, is wearing a face covering that fits your face well. That's way more effective than wearing an N95 that doesn't. But when we are fully aware, and we're following and have been reviewing all of the guidance around masking, and we have seen the data to support the different layers and levels of masking based on activity, most specifically around the 3-ply surgical mask, the KN95, and then the N95. So we did make the recommendation, the minimum recommendation for the mask preferred on campus to be that 3-ply surgical style mask. And those are available all over campus. So if you haven't been to our COVID website, please check that out. There is a mask distribution point side link on the right-hand column. If you click on that, it shows you all of the distribution locations where you can get several free 3-ply surgical style masks. So those are widely available. We have an abundant stock of those, and we definitely encourage folks to use them. In terms of the N95s, as Provost Storrs alluded to, we have been working very hard to secure a large quantity of those, but we are not the only one in that boat. Everyone is searching for the N95s, high and low, far and wide, to secure them for their population. So they're in high demand right now. And especially in ordering in large quantities, it's a little more challenging. So we are taking the approach that the provost described in prioritizing those for the faculty and for staff who are front facing. But as mentioned, GTAs, the graduate teaching assistants, fall into that faculty or that teaching component that we're describing. So they have been delivered to all of the dean's offices. So if you're a graduate teaching assistant and you haven't had an opportunity and you're interested in one of those N95s, reach out to the dean's office to get those. We continue to source N95s, and we're very hopeful that we can obtain more, and if we can, we'll increase that distribution. But I will say for students, if someone is at high risk or has significant concerns about their health, they too can receive an N95 at our Elliott University Center. So we've set up the EUC main desk there to be the distribution point right now for any student who may be at high risk or significantly concerned about their health, where they can pick one up. But stay tuned. The key takeaway here is to really just wear that mask that fits appropriately.
Zach, can you answer the question that's been posed? How often we'll be able to distribute the N95 masks to our instructional team, including our graduate students who are teaching?
Yeah, great question. So we secured several thousands of those masks, and it's our priority in our prioritization to ensure that faculty and graduate teaching assistants and those frontline staff have the quantity of masks they need for the semester. So we are holding back N95 specifically for that purpose, so we can ensure the instructional faculty and graduate teaching assistants have those through the semester. And we hope that we can continue to supplement those as needed, but we have secured enough for this semester overall. And I will say, just while we're on the topic of N95s, there's a lot of activity in the community right now where you can get an N95 as well. Guilford County Public Health is holding some drive-through operations where you can pick up N95s by the box at 20 at a time. There's going to be one at the Coliseum on Saturday, weather permitting. And there's several others. You can go to pharmacies and grocery stores now, thanks to the federal government who has distributed them out. So there are a lot of ways which you can get the N95s if you're interested, not just through us, but in the community. They're widely available on the shelf now as a small purchase. So that can definitely be a method. And I think the last question there was around, can departments purchase these things? Certainly, anybody can wear whichever type of mask they would like. We have seen where departments have purchased the KN95 masks, and that's fine. So as I said before, the chief takeaway is just make sure that you're wearing a face covering that fits.
Awesome, thank you. I think the next question that was posted in chat was that information you just mentioned about N95 masks, if that could be shared with the campus community, that would be awesome. All right, our next question is about alternative learning options. How is the university managing requests from students for an alternative to on-campus in-person attendance for students with medical conditions?
I'll take that one, Lexi. Great to see you. A million years ago, I used to be a grad program director, and it was some of the best fun I had in my professional career. So I'm really happy to join you all. Some of these come to me because that's how they get routed from the portal. So I'll take a swing at this, and then maybe others can chime in. We get a couple of kinds of requests. So one request we're getting is from students who were not planning to be on campus this semester. So they're asking, how can I participate in my in-person courses remotely? And we're not getting a lot of those, by the way. I've seen maybe a couple of dozen. So the demand has not been high for that kind of participation. And then the other kind of request we're getting is students with verifiable, documented medical needs who, for whatever reason, can't be in the classroom either because they are immunocompromised or have other challenges or because they're caring for someone who is. In the first case where students weren't planning to be around or they just feel uncomfortable being on campus or they're concerned about COVID, we don't have a central way to sort of wave a magic wand and say you hereby can participate in your in-person courses remotely. So what we're asking those folks to do is talk to their instructors, their faculty members about options for short-term remote participation. That's a lot of work on the faculty member. I want to caution this is not, most of our courses are not designed for sort of a la carte delivery. So you can ask, they can say no. We've heard that faculty members have granted a lot of flexibility, not just this semester, but in the past several. I'm actually really proud to be part of this faculty team that has given such grace and such flexibility to our students. I see heads nodding among the panelists. So there's that. Now, those students who have who have documented medical challenges that keep them out of the classroom, what they should do is contact the team in ORS and Brett Carter's team, and that team will evaluate for appropriate accommodations for those students. Maybe Brett, you want to say a little bit more about that process and how you do that?
Absolutely, thank you, and certainly, yeah. So, to echo what Dr. Hamilton has said, students who have medical situations and need accommodations, we strongly encourage that you contact the Office of Accessibility Resources and Services. They can do virtual consultations. Certainly, they are available to do walk-in consultations to kind of sort of explore options with you. Another option too, and certainly we know that there are students who may not necessarily have medical situations, but things do come up and we recognize that. And I just kind of sort of want to emphasize what Dr. Hamilton has said, and that is first work with your faculty member. And I always like, when I'm consulting with students, I always like to share with them, the most important thing is to try to be as proactive as you can. If you're anticipating something coming up and you need kind of sort of a short-term support with your academics, to work with your faculty. And then if all else fails, consult with Dr. Andrew Hamilton's area in terms of reaching out to them if you need some additional support. Or for graduate students, you can also contact Dr. Bell in the graduate school's office, because they can, as well as explore options with you. So, yeah. Hope that answers the question.
Yeah, I think you answered our next question too. We were going to ask for specific clarification for students that can coordinate with ORS or their academic units regarding COVID and health related concerns. So
yeah. The key there is trying to be as proactive as possible. Explore those options. Consult with your faculty first, and then if all else fails, reach out to the resources on campus. And again, ORS is one of those great resources that can kind of sort of help students navigate that.
Thank you, Dean Carter. Our next question is not about people's medical conditions, but really a support for a hybrid option. How can we ensure hybrid options for all students who need them, and tech support for all faculty to ensure hybrid courses to accommodate this virtual participation?
I'll take that one too, Lexi, or at least I'll try. I think built into that question is an assumption that hybrid instruction for non-hybrid courses ought to be offered, and I'm not quite sure that's right. I think what the provost said at the outset and what the chancellor said at the outset is our data show is correct. Our students, most of them, especially the ones in in-person degree programs, learn better when they're in person. We just really can't offer a sort of a la carte mode of instruction consumption of each course on a sort of day-by-day basis for students. What we have done this semester and for several past semesters is offer a great deal more remote instruction than is typical for a non-pandemic term. Again, it's true this term. So we've built some flexibility into the way the courses are designated in the schedule. What we really can't do very well is create opportunities for students to choose to participate remotely in in-person courses, in in-person degree programs. Now, we have, in the fall of 2021, we designated a course type as hybrid, so students can search in Genie or in Course Scheduler for hybrid courses if they want some in-person instruction and some online instruction. Or they can search by the other course types. But a couple things about that. We're not getting a lot of those requests. I got maybe a couple of dozen from graduate students and undergraduate students, but we are thinking about what the future might look like at the same time.
Can I add to that, Dr. Hamilton? Part of the question that was posted in the chat had to do with providing support for instructors on if they choose to do hybrid. And I can't say enough about our UTLC program, our University Teaching and Learning Commons. They have incredible support there. If you are a graduate student and instructing and want to learn more about the hybrid option for your students, please reach out to them. They're more than willing to help you. And there are other faculty on campus if you need support, we can certainly help identify somebody to support you as well. Dr. Bell, Greg Bell, our interim dean of the grad school, is certainly somebody who can provide some assistance, as well as connecting you to other senior faculty who've had that experience. But the UTLC program, they're ready to support you if you're interested.
Thank you both for those answers. Our next question is about contact tracing. Why has the process for contact tracing changed?
Hey, Lexi, I'll be happy to take that one. I have become the resident contact tracing expert. Prior to the pandemic, didn't know much about it, now very much about it. So at the very onset of this pandemic, we actually partnered with Guilford County Public Health and signed a memorandum of understanding that gave us the capabilities to do contact tracing, real similar to what the county's doing. And in fact, it makes us an extension of Guilford County Public Health in our contact tracing efforts. We decided to do that early on because we wanted to provide a high level of service to our stakeholders here on campus, our students, faculty, and staff, to make sure that we were performing contact tracing in a timely fashion. And I think we've succeeded with that. Now, fast forwarding to Omicron, we learned a lot as it relates to the contact tracing and trying to keep up with the volume of positive cases that the community's seeing, but most specifically us on campus. So as the State Department of Health and Human Services and Guilford County started looking at what are we doing for contact tracing and what areas can we be more effective and efficient to process a higher volume. So they put out new guidance on January the 11th, 2022, which kind of speaks to what the Chancellor mentioned early on, is we had to make changes quickly. And one of those being the contact tracing. So with these new recommendations or new guidance rather, and prioritization from county public health and state public health, they said two things. The first one is we need to automate everything we can with the contact tracing process so we can keep up with the volume. Because what we don't want to happen is for positive cases to sit idle while we're trying to make contact with each and every individual via phone, when we can automate it and start hitting everyone as they come in, so to speak, to get the answers that we need and identify the contacts that may be a close contact. So that was the first, the automation piece. The other was they removed, I say they as North Carolina Department of Health and Human Service, removed higher ed from the prioritization for traditional contact tracing. And what I mean by traditional is picking up the phone and talking to each and every individual who's tested positive and working through a very long and rigorous interview. So what they said is remove higher ed from that list. However, we still need to do contact tracing. So what we've done is we've struck that happy median, and we decided because residential students require the most logistical support when it comes to isolation and quarantine, that is the population on campus that we continue to do the traditional picking up the phone contact tracing, again, because of that logistics. Everyone else, we've moved to the automated version of contact tracing. And actually, it's anecdotal right now, but I'm going to have the data soon to support it, is that our campus community is responding better to this virtual positive case interview and identifying close contacts through that method. So that's actually been a positive out of this transition. So the way the process works now is if someone tests positive, they still come to our case management team, but instead of getting a phone call, you're immediately going to get an email with a link to complete the positive case interview. It's nearly the same process. It's streamlined a little bit, but we're asking, have you been on campus, to help identify if you've been a risk and who are your close contacts at the university. And that, again, has been very successful. So if I were to identify a close contact, that goes to our case management team. They do the research, make sure they're a UNCG student, and then that close contact gets an email which says you've been identified as a close contact with lots of instructions. So we've tried to automate this start to finish, but the key takeaway here is we need everybody to be paying attention to their email, more so than usual. The subject lines are very specific. So if you can do that part, I think we'll be successful in this. The very last piece that I'll mention about contact tracing, because I know that's been a question by a lot of the graduate teaching assistants and our faculty, is what about in the classroom or classroom contact tracing? I will say that we were one of the only universities that I know of in the nation that was actually going to the extent that we were with using the class schedules, the seating charts, and the rosters. So we looked at the data of our process, and when when the isolation and quarantine period changed from 10 days to 5 days, we went back and looked at all of the positive case interviews that we did and the contact tracing we did in the classroom at that timeline. And what we found is that classroom contact tracing was not a quick timeline. We had to get the positive case. We had to notify the instructor. They had to, obtain the seating chart and all those things. And by the time we had that worked out, we're nearly on day 5, which is the end of that quarantine period. So it just didn't make a lot of sense resource-wise to continue to do that, coupled with we have not and still haven't documented any case of classroom spread with wearing face coverings. So with those 3 stars aligning there, we just felt that that was the appropriate way from an efficiency and effectiveness standpoint to move the contact tracing program along.
Thank you, Zach. And Dean Carter, you had a question you were going to address? You're muted.
Actually, I've accidentally put that hand up. I apologize. I'm sitting here playing with my phone. Sorry.
No problem. Thank you. Our next question is about classroom social distancing. Why is there no longer social distancing in classrooms?
Lexi, I'll take that question. We went back to full classroom capacity in the fall semester for reasons that Zach noted. We have the vaccination policy, the testing policy and practices, and most importantly, the face covering requirement. And so the fact that we had no evidence of spread in the classroom and that both students and our instructional staff are really paying attention to the wearing of the masks, especially the N95s now, led us to the decision of not doing classroom social distancing. Now, we have a lot of classrooms that are small where you can't social distance. But again, we have all those other layers of protection. In the cases where there are larger classroom sizes, and they do exist, where you have capacity to move around, certainly instructors are encouraged to use that space if that makes them feel more comfortable. But that's really the reason why we went back to the regular class capacity.
Thank you, Provost Storrs. Our next question, has Academic Affairs considered reinstating the academic relief policy options that were available in spring and fall, or for spring and fall 2022? And to remind everyone, that was the satisfactory, unsatisfactory, or withdrawal options. And additionally, for PhD students, are changes to academic milestone timelines for completion for PhD students being considered, especially, for example, for our comps and time to degree completion. A couple of students used the rationale that faculty tenure clock was temporarily paused and that specific resources that we needed were not available.
Lexi, I'm happy to take that question. So hi, everyone. Greg Bell, he, him, his pronouns, interim dean at the grad school. So the academic relief policy, or ARP, has been mentioned as a discussion item for the next graduate council policy committee meeting. So it's on our radar. As Lexi mentioned, the ARP was provided to students over a 4-semester period from spring 2020 to spring 2021. It wasn't provided in the summer of 2021, and it wasn't provided last fall. But there were 3 components to the policy. The first was that after a course grade had posted, students could petition to change that letter grade to a grade of S or a grade of U for satisfactory or unsatisfactory. Students could also request retroactive withdrawal from all of their courses or retroactive selective withdrawal from just a few of their courses after the semester ended without penalty. And there was a third component. Students could extend the grade of I for incomplete up to a year instead of the usual 6 months. So the data show that not very many people took advantage of these options. Between 1% and 2% of our students used some form of either the pass-fail option or the withdrawal option. The data on the I's, extended I's, it's a lot harder to get at that data just because what happens to an I is either it's addressed and then it becomes a graded course and the grade replaces the I, or the I is never revisited and eventually it will become an F grade, and then you can't change that F grade. What we do know is from that semester, or those 4 semesters, we saw a big uptick in the number of I's turning to F's, so the number of unaddressed incompletes. There were some unintended consequences of the SU option. Some programs simply can't allow it because of accreditation. The assignment of whether the course, the course is graded, the instructor assigns a grade, a letter grade, and then the assignment of whether that's an S or a U is going to depend not only on the program, but how the student has done in that program. So it's a very detailed ad hoc process. Each case has to be examined individually to see whether that qualifies as an S or a U. And once the grade of S or U is established, you can't undo it. And this has caused challenges in a couple of situations where students need to provide an actual letter grade for a course, and they're unable to do so because they just have an S there instead of a letter grade. It also has implications for academic good standing, the minimum GPA required to graduate, financial aid, these sorts of things. So what I would encourage you to remember is that there are other policies that exist already in the graduate school that have existed for a very long time, and they can help with some of the challenges that you may be having. Early communication with me, with my office, is essential to make sure that we can address those issues before they become problems. I want to touch also on the departmental milestones and the time extensions, so that sort of thing. As your graduate dean, I've encouraged departments and programs to be as understanding and as possible to offer grace and leniency when it's available. But as I said before, some programs simply can't do it because of accreditation standards. There are very few of those programs. What we're seeing more often to be the case is that faculty are being understanding. They're offering grace and understanding to students. But ultimately, these decisions lie with the faculty. Like any curricular decision, it's the purview of the faculty, the experts in the discipline. So the key sort of takeaway message is that please reach out to me, reach out to the graduate school early. We have lots of different ways that we can help mitigate some of these challenges. Whether it's challenges in terms of milestones, time to degree, we have lots of things that we can do to help with those.
Awesome. Thank you, Dean Bell. That was a great overview of the academic relief policy. Okay, the next question we have is about mental health and financial concerns. We all know that the pandemic has impacted many people's mental health and financial stability. Graduate students have shared this concern consistently since COVID started. What is the university doing to support students' mental health and financial challenges, and how are the faculty and staff prepared for these challenges?
Lexi, I'll go ahead and I'll start by addressing the mental health aspect, and that's certainly an issue that we've talked about in Graduate Student Association quite a bit over the last several years. And we know that the pandemic, as well as everything else that's been happening around us, has certainly caused a lot of students, and frankly, a lot of faculty and staff as well, to be struggling during this time. And so providing support for students in this area is really important to us. I hope that many of you know that we offer counseling services and have expanded that since the pandemic started to include telehealth appointments. So students always have that option to seek counseling one-on-one, but we know not everyone necessarily wants that type of counseling or needs counseling, but we all are trying to really create a network of support for students. So in addition to the counseling services, they also offer group support. There's a variety of groups, including a couple that are tailored specifically for graduate students and really focus on the graduate student experience. We have a number of other groups that are identity-based. We have a new group that's exploring art through their support and conversation. And so there's lots of opportunities there. That we have a couple of new self-help apps that are available on the Counseling Center website for students to learn more about and utilize as well. But the second part of your question about faculty staff is important, because one of the things that we know is that to have the culture of care that we're seeking, and to really for students to feel like there is a network of support around them, we as faculty and staff also need to be sensitive to these issues and understand how we can best identify students who may be in distress, help connect them and refer them to resources. And so we're pleased that Provost Storrs has really made this a part of her agenda and has been talking with faculty and the deans about the importance of faculty receiving training in mental health. And so we have had a number of academic units already over the last couple of months go through some new training that we're offering specifically for them. And so I'm really pleased to see that people across the university are embracing the importance of supporting students in this regard. I'll touch briefly on the financial aspect, because I want to make sure everyone knows about a couple of resources we have through Student Affairs. And then I'll turn it over to Dean Hamilton to talk more broadly about some of the things the institution has done for financial support. But I want to make sure I plug two resources, and particularly for students who have immediate needs. We have what's called the SAFE Fund through the Dean of Students Office. This is a fund that students can apply for one-time emergency funding. So, the kinds of things that might come up in the life of a student that could otherwise become a barrier to them persisting, having a safe living situation, all of those kinds of things. The Dean of Students also works directly with students who are experiencing food insecurity or housing insecurity. And so those are important resources we want to make sure students know about. Of course, we have the Spartan Open Pantry as well for those who may be experiencing food needs. Dean Hamilton, do you want to talk more about the institutional funding?
Sorry, I had the chat open. I couldn't get to the mute button, the unmute button. Thanks, Kathy. Yes, of course, we have continued to treat graduate students much like undergraduate students with respect to distribution of higher education emergency relief fund dollars. And I've distributed, I just looked, several $1 million to several thousand graduate students. Those students are identified based on documented need, which in most cases has to do with the FAFSA, but there are other ways the Office of Financial Aid determines need. We also have students get in touch and identify particular needs that they're faced with, challenges they're faced with because of circumstances that have befallen them, and we do our best to address those. Dean Bell and I often talk about those when they come to the attention of either of us, and what we do is vet those claims as best we can in conversation with the team in the Financial Aid Office. So we have distributed a lot of federal relief dollars to graduate students both automatically through block grants, just as we did with our relatively high need undergraduate students, which was the guidance we were given for using those dollars by the Department of Education, and on a sort of as they become, as we become aware of them kind of basis with additional vetting.
I'd like to just follow up with what Dr. Aiken said about our faculty, and it's really not the work that I'm doing, but Provost Fellow Regina McCoy, who's a faculty member in public health. One of her role in my office is to focus on student success, collaborating across different units. And one of her real areas of focus this semester is really partnering with our student health services and counseling to provide training for faculty about mental health and well-being. And I just met with Professor McCoy this week, and she shared with me that she's been doing many sessions of training and encouraging faculty to get engaged. And so really pleased that faculty and instructional staff are welcoming that opportunity. And if our graduate students who are instructing want to engage, certainly Professor McCoy would be more than happy to work with you on getting access to that training.
Thank you to all three of you who answered that. I just want to, students don't normally have to submit the FAFSA. If we want to receive that automatic funding, graduate students, please submit your FAFSA. We sent out information about that last semester.
Yes, please submit a FAFSA. That's the only way. So we have guidance from the government about how we need to direct those dollars. And if we can't document need, we can't move that money.
All right. Our next question is about testing and vaccination at UNCG. Can you tell us what is being offered for testing and vaccination on campus?
Oh, goody, it's my turn. So in terms of testing, testing is available at Student Health Services. We have the ability to do both rapid antigen and rapid PCR testing in our clinic. Right now, we are testing primarily symptomatic students and certain close contacts. They have to meet certain criteria to be tested in our clinic right now. To be tested in our clinic, though, may require a telehealth visit or a virtual visit with a provider ahead of time, which is different than if you go and get tested in the community. That's partially because we want to make sure that testing, that COVID test, is the only test that you need. A lot of people have forgotten flu is out there, strep throat is out there. There are other things that we may want to test you for at the same time. So there is a caveat there that you'll be asked to have a virtual appointment with one of our providers before we get you set up for the testing. But the good news is that when we get you tested, we can get your results back pretty quickly. So we're very fortunate to have the capacity to do that now. So in terms of vaccinations, our immunization department at Student Health Services has been offering the COVID-19 vaccine since we were a vaccination site back in the spring of 2021. We are offering Pfizer and Moderna vaccines, and we are offering them by appointment only. We typically are doing those vaccine clinics on Tuesdays and Thursdays. And this is for individuals who have not been vaccinated and want to start their initial series, or for folks who want to have a booster. You just call our main office number and we can get you scheduled for an appointment. We're more than happy to take care of that for you. I'll turn it over to Dr. Akins to talk about the campus testing.
Thank you, Dr. McMillian. So for those who are asymptomatic, then the options for testing are to do testing on campus, and those are held in the EUC. Those days are Monday through Thursday. Some students may be familiar that students who are in the mandatory testing program are testing on those days as well, but we have made those available now for all students, faculty, and staff. So that the times and locations are on the website, but it's Monday through Thursday. I know there was also a question about someone expressing a concern about a delay in getting a testing result. And what I'll share with that is you may know that with the surge, there has certainly been a bit of a delay throughout the community in terms of getting testing results. But one of our vendors was having a particular issue, and they have been addressing that. So you should see more timely results. I would say for the majority of our testing days, people have been getting test results within 24 to 48 hours.
Awesome. Thank you for sharing that update. Okay, now about quarantining and isolation. There has been changes to the guidelines regarding quarantine and isolation, which we talked about briefly earlier. Can you talk about the 5-day period and why people are not required to submit a negative test before returning?
Yeah, Lexi, I'm happy to start that one off, and I'll turn it over to Dr. McMillian there towards the end to talk about the exit strategy, so to speak, for isolation. So one of the challenges I think we all seen as we started this semester and then the CDC changed the two most important tools we have aside from the vaccine at the very same time. The first one being the contact tracing, and the second being the isolation and quarantine protocol. So we're made a lot of changes there fast at the beginning of the semester. Not opportune, but it's the hand we were dealt. So most specifically around the isolation and quarantine, it did move from a 10-day isolation or quarantine period to a 5-day. And there's been a lot of conversation about that in the medical community and scientific community for a good while before that change was made. And they made that change based on a lot of scientific research. And there's articles out there on the CDC website that show the data behind this. But most specifically around isolation, what they saw in the studies is that those who tested positive did not transmit the virus, or there were no close contacts after day 6 from a very large study. So basically, after day 6, they could not identify any other close contacts to positive individuals. So that change was made to really help society as a whole. We want to be very cautious as it comes to releasing a sick person back into society, but at the same time, the mental health standpoint, if we can safely reintroduce folks at day 6 instead of day 11, that's an objective for us to reach for. So we as a university adopted that practice. So we are at the 5-day isolation or quarantine. But that's kind of just a general rule of thumb, so to speak, when it comes to the isolation and quarantine protocol. If there is someone who is still symptomatic or still has a fever or just doesn't meet the criteria, then that can be elongated. So that's just the standard. And I think Dr. Vermillion can probably elaborate on that a little bit and then talk about the clearance process.
Sure, I can elaborate a little bit. I would like to go back first and kind of explain how these changes occur. When the CDC puts out this guidance or a recommendation, it doesn't automatically mean we instantaneously adopt it. Our kind of process is that it then has to be reviewed and accepted by the State Department of Health and Human Services, and then it has to come down to the local entity, local public health entity. So when that change was made, we were staying with our 10-day until we got word, until things kind of came down the pike and they were reviewing the data at each step, the scientific data at each step, just to make sure that it made sense for us to make that move. But in terms of once folks are cleared, on our case management team, the students that are in isolation do receive notification towards the end of their 5-day period, asking them about their symptoms and assessing for fever. And if they are exhibiting either of those, then their isolation is extended, and then they are followed back up with in a few more days, and that's noted in the record. And we've had, a percentage of our students that we've had to extend their isolation because they still were having symptoms. The other thing that I would like to add is that when they are released from isolation, they are still instructed to wear that well-fitted mask and face covering for the additional 5 days to make the full 10 days that the isolation period was previously.
Thank you both. And we're nearing the end of our submitted questions. We only have about 6 minutes left, so we can do it. This is about programming expectations. Why or what are the expectations for programming and activities across the university, and why does this seem to vary across campus and in divisions?
I can go ahead and start that one, Lexi, and if anybody else wants to jump in, feel free. We do have event guidelines that are on the university's COVID website. What I will share is that these have evolved and changed throughout the pandemic because we've sort of continuously evaluated what we're doing based on what the current conditions are and what other local guidance might be in place. I think where we're at now is we're really trying to strike a balance between having some level of engagement within the campus community while keeping safety top priority, obviously. And so there is not a centralized approval for events, but it's expected that event planners and leadership within the units are familiar with the current guidelines, and particularly the things that include like making sure that participants are aware of our policies around face coverings and enforcing that. We are really encouraging right now those things that can be virtual to be virtual. But I think the question about why might there be some differences between one area to another is I think each of us in our respective units and divisions are prioritizing. We know we don't want to do everything in person. We want to limit that. So we're prioritizing the things that we think are perhaps most important for students to have the opportunity to do and engage with in person, and then doing the things virtually that we can. I know that for students, we also have some guidelines around student clubs and organizations. And what we're saying to them now as we're moving forward and hoping for a little bit better time is we'll take a look at some more in-person events when they're when they are safely planned. But we also would like students to continue to do meetings virtually. Again, just trying to prioritize and limit to keep people as safe as possible.
Thank you, Dr. Akins. And the last one that we got from our submitted survey was, in what way can you support a dialogue on campus that can help profess the complexities of the pandemic?
Lexi, I'm happy to speak to this. I'll just go ahead and offer, I used to be the GSA co-advisor, and I really enjoyed meeting with the Graduate Student Association. I would love to be invited to future meetings to speak with you all, to listen to your concerns. If I'm invited, I will do my best to be there. I can bring friends if you would like, or I can come on my own. But I think that that's important to, for me to be there to listen to your concerns and to offer any answers or to find spaces where I can advocate for your concerns.
Dean Bell, I would just echo, I would welcome an opportunity to meet with graduate students if that would be helpful. It also gives me a great sense of your experience. So happy to participate in any way.
Provost Storrs, you have been on my list for a while, so you will definitely be getting an invitation this semester. I think I want to clarify that last question a little bit. I think students are looking for a dialogue to be sent out with updates about what is going on. So can that be found on the COVID webpage?
The COVID website is updated constantly, Lexi. The team that is working on different aspects of it ensures that the information that is new and evolving is on the website. And of course, more specifically on the dashboard is the data information that I think a lot of students are already familiar with. So yeah, I would definitely suggest that if students haven't spent time on the website to do that, because there's a lot of great information up there and that's updated.
And Lexi, if there are things that folks are looking for there and not finding it, we need to hear that too.
Yeah.
All right, panelists, does anybody have any other information that they are dying to get across to graduate students before we wrap up? All right. Well, graduate students, I hope that you really heard a lot of support today and you know who you can reach out to with questions, which is especially the GSA. So I just want to say a huge thank you to all of the panelists for being here and sharing all the things. So thank you for that. And thank you to all of the students that attended the webinar and submitted questions for the webinar. If we were unable to get to your question due to time restraints, please email me directly at gsavppgm@uncg.edu. Claire is going to drop that in the chat for you, and we can assist you to find your answer or your solution. Also, the Student Government Association, or SGA, is going to be having another opportunity for students to have additional questions answered. Graduate students are welcome to attend this, so be on the lookout for SGA's COVID response. A recording of this webinar will be posted on GSA's YouTube channel in the next couple of days, and Claire is going to share that YouTube channel link with you as well. And I just want to say a quick reminder and shout out for GSA is a reminder, graduate students on the call, our first assembly meeting is next week on Thursday. That is February 3rd from 5 to 6 p.m. We are now in the new nursing building, room 101, but we are hybrid. So you can find that Zoom link on our website. And we really hope to see you there. So thank you all for making this a successful webinar, and we wish you a good evening. Thanks for coming.